Have you ever had pain, such as shoulder pain, and been told the muscles are weak and then been given strengthening exercises that made the pain worse? Yeah, it's common in the medical and physical therapy world, and totally misguided, which is why so many pain sufferers are failed by physical therapy. Most medical people are still working from an injury-based view of pain created in the 1600s that is completely false according to modern neuroscience. And most physical therapists are also operating from the false dichotomy of if a muscle is weak, it needs to be strengthened. If a muscle is tight, it needs to be stretched. The truth is, most pain is not from tissue injury. It's not from nerve compression. It's not from inflammation. It's not from weak muscles. It's not from tight muscles. It's from trigger points in muscles. Trigger points are microscopic areas of metabolic stagnation in muscles. These little points of stagnation cause large pain issues. And although the medical research on trigger points is robust and has been continually growing since the first edition of the Trigger Point Manual, written by Drs. Trabello and Simons, published in 1983, the awareness in the medical industry is not growing. Trigger points cause muscles to test weak, and they refer pain, especially when the muscles are asked to do work such as with strengthening exercises. See, the muscle fibers with trigger points are already in a stuck state of contraction, known as contracture. They can't respond to the nervous system demand to contract. They are already in a stuck contraction state, contracture. So if a muscle has, for example, 30% of the fibers in contracture state, that's 30% of the muscle that can't contract to do work when the nervous system demands it. Instead, the muscle will test weak, and it will refer pain, especially if put under demand to do work with strengthening exercises. If the body perceives a movement as dangerous, it will produce pain and shut down the movement. Pain is an output of the nervous system, not an input. The additional thing that fools everyone is that you don't feel pain where the problem is in the muscle. Trigger points refer pain to another place, usually 1 or 2 joints away from where they live. But the good news is, these pain referral patterns are very consistent and have been meticulously mapped out by researchers. If you know the patterns, you can quickly figure out where the source problem is for any pain issue. The incredible thing is, instead of putting a muscle on a painful strengthening regimen that doesn't help, if instead you treat the trigger points and reduce them, the muscle is instantly stronger, and the pain referral is reduced or eliminated. That's what actually works and how you can retrain pain-free movement quickly. Once pain-free range of motion is established, then incremental strengthening is beneficial. Let's see an example. Will experienced top of the right shoulder pain. This pain was produced when he abducted his arm. Based on functional anatomy and pain referral patterns, Will's pain was coming from faulty scapulohumeral rhythm created by trigger points in the scapular stabilizers due to overload of these muscles. Instead of trying to strengthen the rotator cuff or scapular stabilizing muscles, applying coaching the body trigger point therapy to these muscles eliminated the pain and restored range of motion in 20 minutes of manual therapy. Most pain is not from injury or tissue damage. It's from trigger points in muscles. Pain is not due to weakness in muscles. Back up 1 step and ask why the muscle is weak. Trigger points cause referred pain and weakness. You can't strengthen your way out of pain. Strengthening exercises will just overtax struggling muscles. Treat the trigger points in the appropriate muscles, and the muscles become instantly stronger. Establish pain-free range of motion first, then incremental strengthening exercises can be beneficial. So we moved a few degrees. So he's at 90 degrees, but our scapula has only moved a tiny bit. So, and what do you feel there, Will?
Tension at the top of the shoulder, trap, front of the shoulder, neck.
Right. Okay, now I'll go ahead and bring it back down. Now we'll do a muscle energy technique. We'll do contract and shorten. So go ahead and push your shoulder back. So he's engaging his low trap right now. Inhale, hold your breath. Yes, and hold it for at least 5 seconds. And then exhale. On the exhale, he lets the shoulder relax. I'm going to come in with compression, and I'm going to treat it on the short. I'm going to give it feedback and then bring it into shortening. And as soon as I feel it contract, then I'm going to let up and bring them back out of it. So I'm retraining that low trapezius to passively shorten without contracting on the short, and it's doing it already. So that's good. the fastest way to treat this muscle is using the EPS and going underneath the pec major and getting the points directly on pec minor and getting a motor response. So I'm getting a motor response now. I'm going to move it around a little bit, see if I can maximize it. Even just that pulsing has changed the tone of it quite a bit. It's already soft. So we'll give it some length now and see if we get a little more out of it even. So I'm going to put my hand at the front of the shoulder. Now he's going to protract, so he brings his shoulder down in against me. So that's shortening pec minor. Take an inhale. He holds his breath for 5 seconds. And exhale, relaxed. He relaxes. I'm going to stabilize his scapula with this hand. I act like the low trap here, and I'm going to retract his scapula with my 2 hands. And I can feel a heart bundle right there. So for Vi, I'll just take a couple seconds here to do a little bit body work in the short. So this is a nice technique. I can get my elbow just below the clavicle. And I can get some compression on the short. So this is a direct shortening of the clavicular pec with the arm going into flexion and adduction. Okay. I'm going to apply some liberating K on the short. And now we'll bring that muscle into some length. So I bring his arm down at about 45-degree angle or so. And then I'm going to start to bring his arm into rotation and extra rotation and just see where we're at here. What do you feel as I start to bring it in? Okay. So you might, if the middle trapezius area, low trapezius, was still unhappy going short, as I externally rotate his arm, he might feel pinching back there. So I'm going to monitor if that's happening. And I just feel a lot of tension here. So you feel any stretch happening in the clavicular? Or what do you feel?
Mm-hmm.
Okay.
It's just kind of slow going, but I definitely feel it.
Okay. Rotate your arm into me. Yep. So he pushes his arm into me. So that's medial rotation. That's going to activate the clavicular pec. Deep inhale. And exhale, let it go. Then I'm going to bring the arm into stretch, bring the pec into stretch here with my body as I apply the liberator.
Just keep track of I'm keeping track of where the clavicle is, so I stay right below that.
Now, I want to see just what's happened with the antagonist fibers here. And they're way happier to go short. Yeah, it feels much different now. And the rotation of the scapula is pretty smooth already. Interscapular muscles are happy going short. The shoulder's going back. So we've changed that front to back relationship pretty much. We're just going to go to the straightest anterior now and see what's happening there. There's a big bundle, so I'm going to keep track of that. And I'm just going to take an initial assessment here. So as I rake downwards, I feel another bundle about here. What's the tenderness? Okay. And then I'm going to continue downwards to the lowest fibers. And there's a substantial bundle down here too. I'm going to start with, I'm going to put him in a shortened position and just stimulate the fibers with the liberator first like that. So if I just put his shoulders forward, that will shorten, it'll abduct the scapula a bit, and that's going to shorten these muscle fibers. I'm going to see where the inferior angle is, and I'm going to go just in front of the inferior angle, because that's going to be about where my belly of these fibers are. That's where where I can stimulate a motor response or a twitch response. And that's where the neuromuscular junction is, where the trigger points happen. Now I'm going to bring him into the contract relax and get some length on these fibers. So I'm going to palpate with my arm first. Okay, there's the bundle the low fiber bundle. I can actually palpate it with my forearm and feel it right about there. So you go ahead and protract your shoulder. So that's going to engage the sternus interior. Bend, inhale, and hold. And exhale, relax it. So he lets the arm relax. I'm going to use the arm as a lever to add up the scapula. So I'm going to get my compression against the ribs on that hard fiber bundle, those low fibers, and then I'm going to push down on the arm to add up the scapula. What do you feel?
Only where the compression is.
Okay. There's the inferior angle. Okay, go ahead and start to abduct the arm. And it's moving way better now. There we go. So that's a lot less sticky. And what do you feel?
Every bit of the deltoid pain and the top of the shoulder, trapped clavicular pain is gone. Don't even feel it in my neck, which was always tight.
Okay.
And it flows out.
Right. So he's got full range here. Everything seems to be pretty good. So that's working. We just did the scapular positioning treatment. We just treated the scapular positioning muscles, the ones connecting to the scapula and involved with the proper functioning and rotation and movement of the scapula. And the neck and shoulder deltoid area pain that he was previously experiencing, he's not getting anymore. So this, a lot of times people will have top of the shoulder pain, or they'll feel it into the lateral deltoid area. Sometimes the front of the shoulder, he was getting some of that too. All that is gone, and we haven't done anything to the rotator cuff muscle. That shows you how important the scapular stabilizers are for the healthy movement of the shoulder. Most practitioners would do some type of intervention on the local muscles, but it was all stemming from the fact that his scapula didn't have proper rotation. So that treatment resolved that, and now we can go into some strengthening exercises for the shoulder. Remember, most pain is not from injury or tissue damage. It's from trigger points in muscles. Pain is not due to weakness in muscles. Back up one step and ask why the muscle is weak. Trigger points cause referred pain and weakness. You can't strengthen your way out of pain. Strengthening exercises will just overtax struggling muscles. Treat the trigger points in the appropriate muscles, and the muscles become instantly stronger. Establish pain-free range of motion first, then incremental strengthening exercises can be beneficial. If you are a physical therapist, massage therapist, or other manual therapist, learn more with our free training linked in the description. Thanks for watching.